So my name's Austin Hayes. I'm a plastic surgeon in Portland, Oregon. Well, I do breast and body, and I do labiaplasty. So people come for kind of the whole spectrum of what falls into that category. So breast lift, breast reduction, tummy tuck, breast augmentation, and labiaplasty, which is decreasing the size of the labia minora. But probably I've been on this journey to try and make my breast lifts and my augmentation, but it started with mostly with breast lift and then jumped into augmentation. But I've been on kind of maybe like a 4-year journey of trying to create the best breast lift that I can. So to make a long story short, the thing that people come and ask me about most now is breast lift and reduction, because I created an operation that's pretty unique. And I did that about a year ago, and the word's starting to spread, which is really cool. So I didn't know what to call it, so I called it the double bra. Unfortunately, now it's actually 3 bras. I named it too early, but essentially it's an exceedingly meticulous way of securing the fold. And the fold of the breast is like one of the most important parts of the breast lift and the reduction. And if you can get that right and figure out how to secure it properly, it completely changes the way it looks. And I'll tell you a funny story. I can't believe I'm admitting this, but Taylor Swift's first concert, I think it was in Arizona, was going on or had gone on. And my wife came home and said, "Oh, the concert's apparently amazing. It's 30 something songs. It's, more than 15 outfit changes." And I was like, okay, we have to go for sure. So booked tickets for that upcoming weekend, which was in Las Vegas. So flew down to Las Vegas. We had gotten off the airplane and we were sitting having breakfast, and it was like a light bulb went off. And like got a napkin from the waiter and a pen and just started drawing and just drew out this operation that had just popped into my mind. And that's the double bra. And then did the first one on Monday, 2 days later. Yeah, so it's funny, like, I would say that most of the cool innovations I've had in my career have kind of come like that. Think on it, you think about something for a long, long time, and then eventually you can't exactly pinpoint the origin of where the idea came from, but it kind of popped in, which is so cool. I think I told them it's not like it was, taking a big new risk. They already knew how I thought about breast lift and how I thought about reduction, and that I thought that securing the fold was supremely important and the way that I was planning to do it. And so it was a major but a minor twist on that theme. But yeah, we did the first one and it was incredible how different it was. It wasn't even close. And you could tell on the table. And then those results continued. So that was just, super gratifying. I mean, the first 3 patients were women who had relatively small to medium-sized breasts. So to be able to do by securing the fold properly, the way you can tell that it's working is that the scar is truly in the fold. If the most, or I should say many, I can't say most, I don't know what every surgeon does, but many breast lifts, the majority of breast lifts, the breast tissue falls below the weakened crease. When you do the lift, you typically make an anchor-shaped incision, and that incision that lives in the fold weakens the fold. And many people do nothing to support it. I would say that's most, but again, I don't know what other surgeons do. And then some surgeons sew it, and then there's, again, the double bra, which is kind of that double sewn layer. But to know that it's working, you look at the scar position. And so when the scar is riding up onto the breast, and this can happen, up to an inch and a half, the breast is sliding down their torso. They're losing volume out of their breasts and they're losing fullness at the top. And so the first 3 were small to medium-sized breasts. So to be able to accomplish it was not the true test. A single sewn layer can do that. But when we were doing larger and larger patients over the subsequent months and it was still holding, that was where it really starts to shine and really the difference becomes noticed. The best place to find me at Dr. and then my name, Austin, Austin, Hayes, Hayes. That's my Instagram.